Hey everybody, I'm Hillary Struby.
And I'm Wayne.
And we are interviewing Miss Kayte Forester.
Forester.
That's how it's spelled.
Forester, yeah.
Forester.
Like the car.
Yeah, Subaru.
There you go.
And we're going to be talking about lymphedema.
Yeah. All right. Well, so what we usually do is, since nobody knows who you are.
Or everybody does.
Everybody should. But tell everybody about yourself and how you became an amazing PT that does lymphedema.
Cool. I'm Kayte Forester. I am a physical therapist. Originally started pathway towards orthopedics, and in my final rotation as a student, my clinical instructor was a OCS, or board certified orthopedic specialist, and a certified lymphatic therapist. So I got to treat quite a bit of those patients alongside her. And then through knowing her and exploring, I learned she was also a lymphatic patient, or a patient with lymphedema. So was able to learn really how her passion with it, and I was so inspired by her story and the people she was able to treat and reach in that area of orthopedics that I was like really touched by that. And then when I became certified as a physical therapist and practicing, I was noticing that I was recognizing signs and symptoms of lymphedema in the clinic. And I was like, well, I think I know how to treat this. I would like to be able to, but there's certain things, as we kind of talk about what treatment for lymphedema looks like, it doesn't quite fit into your typical orthopedic physical therapy setting. It takes a little bit more time, one-on-one time. So I talked with my boss, figured out if it was going to work, got certified, and then I've been able to practice within an orthopedic setting. So.
And how long did it take you to get certified?
So the certification I did through close training, it was 135 hours of didactic information. So coursework I did before that, and then I went to the on-site training for 6 days, 10-hour days.
Oh, wow.
All right.
Yeah.
Super
Pretty
fun.
good. Yeah, and do you need any specific equipment to be certified, or are you able to help with or without equipment?
I can do with or without equipment. Typically for the treatment with lymphedema, your main components for treatment are going to be exercise, because when our muscles pump, when we exercise, our muscles contract and they act as a pump, so it pumps fluid up. So learning the right exercises, compression, so that's the tool that we will need, or that I would need, whether that's wrapping or getting a custom garment. And then manual lymphatic drainage, which is a specialized massage technique that facilitates the movement of the fluid into the certain direction that we know the lymphatic system flows. And then finally, skin care. Your lymphatic system has right underneath the skin, and so when you have lymphedema, it affects the integrity of your skin. Preventing infections is the main key in treatment moving forward, so you don't have major risks or complications. So, as far as equipment-wise, yes and no.
Okay. Like if you wanted the full treatment, then yes, but there's things that you can do that could just help somebody.
Yeah, absolutely.
Yeah. Okay. So, you're kind of going through what lymphedema is.
Yeah.
Yeah. Anything more that you wanted to add on what is lymphedema?
Sure. And then do you want me to talk to you guys or talk to the camera?
Whatever you want to talk to. Yeah.
Okay. Yeah, you can just talk to us, and maybe
It's a convo, yeah. And if you want to
maybe look something,
really reiterate something,
do
Pointing,
that eye
aggressive
thing.
pointing, just like the twitch.
don't listen to that.
The eyebrow wiggle.
Yeah.
Cut, take it out.
Yeah, we can do whatever we want.
Cool. Okay, so lymphedema, what it is a disease of the lymphatic system. So just a crash course in anatomy. We have our blood vessels, arteries, and veins, and then our lymphatic system is kind of like our feeder roads. So when you have blood that goes through your arteries, it's delivered to the muscles, it's packaged. While the leftover proteins in that packaging, your lymphatic system is the trash collecting system. It absorbs those larger molecules and proteins, holds it, pumps it back up forward to the main thoracic duct, where then it can be mixed and excreted through your urine and feces. So there's not like lymph nodes, or there's not lymphatic fluid that's produced here and then sent out. It's a collection of the extra things from the extremities all shunted forward.
Wow.
Okay.
So we have lymphatic vessels, and capillaries, which are right underneath and connected to our skin. Those lead to node groups. The node groups collect, kind of process the extra fluid, and then they send it forward into the next vessel, and then into the next node group, and then finally down. So for example, when you're sick and they feel your lymph nodes here are swollen or bacteria, those lymph nodes are collecting the bacteria and the toxins. They're working to process it out.
Ew.
Right?
Yeah.
So that's why the nodes get swollen there. Everything that kind of drains in that way. For example, on my arm, if I were to have affection here, everything would drain up into the cubital nodes here this way. So it processes it. There's more, kind of like downtown Austin, there's more roads coming into it than coming out of it. So that it can process a lot, but it filters and it's more specific about what it lets through.
It's like in downtown.
Yeah.
You get to Lady Bear Lake, it stops.
Yeah, exactly.
Town Lake, whatever.
When you have lymphedema, your lymphatic vessels are similar to your veins in that they have one-way valves. So they pump forward and they open and they close to prevent backflow. When you have lymphedema, those valves get stretched and they open and they no longer prevent backflow. And then it builds up and it pools. So that's why it goes into the treatment. You have compression to prevent it from pooling.
Okay.
Yeah.
And keep it going.
Mm-hmm.
And do they heal up? Will they unstretch?
Typically not.
Okay. So once you're stretched, you're stretched.
Yes.
Okay.
They have a certain amount of elasticity that they will recoil, but when you have true lymphedema, where it's developed to that stage, and there's different stages, it will no longer come back. So for example, stage 1, you can have days where you're swollen, and then you have days where you're not swollen, because it goes back and forth. But once that starts, research shows it will eventually progress to stage 2 without intervention.
Okay. Okay. Well, I'm going to stop drinking. My feet
Stop.
swell up when I drink. I don't want to have lymphedema.
Well, okay, well,
so that's the next
yeah.
question. Like, what's the difference between regular just
edema
swelling and lymphedema?
Yeah. So lymphedema is a disease.
Mm-hmm.
Edema is a symptom.
Okay.
All right. So when we have edema, it's not necessarily bad, right? If I have a cut and my hand kind of swells up, your body is sending extra things to the area to heal, right?
Okay.
We want that to happen.
Right.
However, when it persists past that healing phase of proliferation, if it lasts more than 2 weeks, that's not normal swelling or edema. That is progressing to the point where, hey, something in our system is not being as effective at keeping that fluid moving forward, in and out. Now it's actually preventing more fluid from coming in. Does that make sense?
Yeah. Oh, yeah.
So lymphedema is typically unilateral or one-sided versus edema. So if I drink too much and I am swollen the next day in both of my feet,
Yeah.
it's usually more of a kidney-liver issue versus a lymphedema.
I got you.
Because it's affecting your whole body circulation. Now that can eventually lead to lymphedema because your veins back up into the lymphatic system. So if I were to close down 4 exits between New Braunfels and San Marcos, then everybody's going to have to go to Hunter and 1101.
They've been doing that, yeah.
Right? So your feeder roads get congested.
Yeah.
The more those get congested, we have to go even further, right? So it backs up, and our body has a natural system to be able to handle overload. But by definition, lymphedema is when the system cannot handle the overload.
Okay.
Okay.
Cool. Good answer.
Yeah.
Good description of it
Thanks.
there.
I know. When do we go into the country roads? That's a bad sign, right?
Yeah.
Okay.
You're going on dirt road.
You're driving through someone's backyard and you're like, uh-oh.
Yeah. That's one thing I always wonder, like, whenever you have that swelling, and people get the weeping, the edema, and I always wonder, like, it's under there, it's just swollen in that meat and stuff like that. Does it get macerated inside your skin? Does it get like underneath that fascia and stuff like that? And whenever you can't get rid of it, like, macerations, like whenever your hand gets all pruny, does that happen inside as well? Does that cause damage to the surrounding tissues?
Well, because lymphedema is like extracellular in that level, not necessarily. It macerates up.
Okay.
But then if you were to, because then it collects into the node vessels in the node group, but it's at the surface level where you have the risk of maceration because of the lymphatic fluid is like seeping out.
I guess, okay. I was wondering if it did that to the surrounding tissues, but okay, cool.
Yeah. And would that, like when we do have inflammation and we hurt ourselves and we want to like rest, ice, compress, elevate, rice, would that work with lymphedema?
Not necessarily. So because that's more of a treatment for edema. Rice, they recently have made a modification. It says with acute swelling, you don't want to use ice immediately. You want that inflammation to be there for a little bit.
Promote healing.
Exactly. Now, if it persists, you want to use that. Lymphedema, you do not want to use extreme temperatures, no extreme heat, and no extreme cold, because that increases or decreases blood flow, and the system already has an issue with transfer of fluids, so you don't want to promote extremes either way.
Okay.
As far as resting, not necessarily, because we want to increase our muscle tone and pumping. One of the leading causes for lymphedema in the United States is morbid obesity, which overloads the area in the abdomen where everything's trying to flow to. You get buildup fluid down the line. Comorbidities such as chronic venous insufficiency, arterial disease also contribute to backing up the lymphatic system. So not necessarily rest all the time, but rather targeted exercise. Elevation does help because of the one-way valves. Gravity works. So in some instances, if someone's been up on their feet all day, putting their feet up, if somebody has upper extremity lymphedema, resting their arm at night or using pulleys system can be helpful in drainage.
Just for a normal, like, daily routine.
Mm-hmm. Yeah.
Okay. Yeah.
Okay, cool.
And what are some specific interventions that someone can do? You said exercise, targeted exercise. What does that include?
So really good cardiovascular routine, whatever that looks like for you. Typically, most of the research, which is lacking in this area, swimming is great because it adds natural compression with the water, and any cardiovascular exercise with compression, because when you exercise, your body's going to shunt blood into the working muscles, therefore increase swelling. If you ever notice, if you've gone for a long walk and it's kind of humid, you feel like your hands are swollen or it's stiff. Mm-hmm. So you want to have compression on when you're exercising.
Okay.
That's a key factor for that. Specific exercises, any sort of cardiovascular exercise, the best would be moderate intensity, because we're not trying to elicit the inflammatory response we would get with hypertrophy exercises or high intensity interval training. That's okay sometimes, but for the most part, typically moderate intensity is more so because of the less likelihood that you're going to have increased inflammation, if that makes sense.
Mm-hmm.
Yeah. Well, the swelling, you aren't getting swollen.
To have that healing portion of like recovery.
Like when I'm doing my bicep curls, my arms get huge, and I don't want that to happen if I had edema.
Yeah, because it probably would make it worse. Yeah. So there used to be this old idea that after women had lymph nodes removed after breast cancer, they weren't supposed to lift over 15 pounds. And that has been far squashed. That theory is debunked. It's that you're not supposed to lift to the point of fatigue, right? You're not, like if you haven't been to the gym, you're not going to go in and do as many reps as you possibly can, because that's going to elicit a delayed onset muscle soreness, inflammation, that kind of process, and the likelihood of injury versus doing things you're trained for.
Okay. So like high rep, low weight, is that kind of...
Yeah, I would be okay with... Typically for my patients, I'll do strength training first. So your good old 3 sets of 8 to 10 reps, or that 6 to 7 out of 10 RPE range, and then progressing to endurance if that's for their cardiovascular.
Okay.
For upper extremity, always doing posterior chain and rotator cuff, because you have scapular lymph nodes, so right between your shoulder blades, you have lymph nodes, so posterior chain strength as much as possible. Also opening up this area so this axillary nodes don't get decongested. with lymphedema, our body's divided into two parts. Both legs, left trunk, left arm, and left half of the face drain into your left subclavian vein. Whereas the right side, the right arm, right side of the trunk, and right half of the face drain into this side. So let's say someone has breast cancer and they have axillary nose removed on the left side. They are more likely to develop lymphedema in their lower legs and arm versus if you just have it on the right side. So then also I always add in, if it's upper extremity, adding in lower extremity exercises as well because of that contribution.
Wow.
They have watersheds, so your right axillary node is going to drain into your left axillary is going to drain into your left inguinal nodes. So doing hip abductor exercises, making sure there's not a lot of hip flexor tension can be really helpful.
Kind of like how you treat almost everybody.
Yeah.
Right?
Yeah. Right. Everything is connected. That's the biggest thing.
It's like scapular retraining, glute strengthening, core stabilization, kind of making your whole body work the way it's supposed to.
Absolutely.
But when you sit, it causes...
compression.
Yeah. So with compression...
or occlusion, I guess.
Okay. Yeah. With compression, does that weaken the lymph node pumping action if they have to use external compression all the time?
Not necessarily. It does affect your arterial system. So the lymphatic compression is, once you develop lymphedema and it's stage 2, which means it's not going back down on its own, you have to use at least 20 to 30 millimeters of mercury to prevent a buildup, which is also what is prescribed for chronic venous insufficiency for like compression socks. So that is enough compression to prevent pooling, but not enough to occlude arteries.
Okay.
Because we don't want to limit blood flow. Over time, and it's also one of the reasons why you do not wear compression garments at nighttime. Some people are like, I want to wear them. Can I wear them 12 hours a day? I'll just wear them at nighttime. It doesn't work that way. Your metabolism is lower. You're not against gravity. You're basically just preventing your nerves from getting as much blood flow as they need. So you don't want to wear them when you're at rest. You want to wear them when you're up and about.
Active to kind of help that pump.
Yeah. And now if somebody has diagnosed with lymphedema, the recommendation is that they wear their compression every day when they're up and at 'em. Some people have night garments, which are not so close to the skin. They allow the skin to get a break, but they still add like a layer of compression, like 10 to 15, sometimes up to 20 millimeters of mercury.
So that'd be the nighttime gear. Okay.
I have worked with several patients where it's enough so like 10 minutes without their compression and they've gained 2 shoe sizes. Like it prevents them from being able to walk.
Well, yeah.
So having that compression on consistently, being able to put on clothes, things like that.
Okay. Yeah. And so you were, sorry, kind of going off a little bit, but you were talking about you were noticing a lot of patients coming in with lymphedema. Were they diagnosed with lymphedema? Did they have any idea, education, knowledge, or were you noticing signs and symptoms because of your background and you were seeing things on
more
the surface?
so the latter. I remember the first time I saw a patient that came in with an ankle sprain and she said it happened 2 years ago. And I was like, that's not an ankle sprain.
Yeah.
It's pretty obvious, like their foot, well, it's obvious to me because I've seen it multiple times, but the type of swelling, like if I sprain my ankle, the swelling is usually like on that medial or on the lateral portion, right? Where it goes into, it makes sense with an injury. Lymphedema doesn't really make sense. The swelling is on top of their foot. There's like a little shelf. Their toes are swollen. And it's also, the skin is very tight across there because the swelling is in a different area, if that makes sense.
Yeah, do you all still do where you press down and hold down and see how long it takes to come back up,
yes,
rebound and
the
stuff
pitting
like
test. Yeah. So if somebody has kidney disease or arterial disease, their skin is very shiny. And when you press, you can see the fluid move. That's called phlebial lymphedema. It's more directly related to arterial and venous insufficiency.
Okay.
Versus lymphedema, which is a change in the lymphatic system alone. That, when you press and hold, you can see it go down eventually, but it will stay there for 2 to 3 minutes. If you've seen someone take their socks off, and they have that indention there, because lymphatic fluid is protein rich. It's very dense. You can't just move it like that.
I gotcha. If you do that with your socks and they come off, you need to go see.
I was like, what?
So some indention is normal, but if it's like a significant, change to where you're like, oof.
But like 2 minutes of that, that's pretty bad. So how do you find somebody to help you out with that? Like, is there a physician, or how do they find somebody that does that?
So unfortunately, there is no medical provider that specifically focuses on lymphedema.
Except for you.
Right. The closest medical provider
As in medical doctor provider?
Yeah,
Okay.
yeah. So there's no physician that's like a lymphatic specialist. The closest you would get would probably be an internist or a vein surgeon.
Yeah.
Or an oncologist. But what I have found in this area, at least, there's a good working knowledge of lymphatic therapists that are available. Like, they know they need to go to a lymphatic therapist, but they don't know what treatment involves.
It's kind of like any doctor then.
Right. So sometimes, me having to tell someone for the first time that this is not going away, that this will be a part of their daily routine moving forward, I have not a fear, but a reverence for that. Like, this is sometimes life-changing information for somebody.
Yeah.
And and I am there. What I typically say is I am your point person moving forward. Lymphedema is a 98% clinical diagnosis. There's no test you can take that says you have lymphedema. It's all about your signs and symptoms. You can do a venous scintigraphy where they inject dye and they track the iodine green, and they track it in the lymphatic system to see if it's congested. But there's like 2 places that do that. So in our nation. So
well, that's not really
it's not very feasible. And they can do so they test for vein function and things like that. So as far as your question, referring to them, finding somebody, checking with your primary care physician. As a lymphatic therapist, I will my job is to make sure you are safe for me to treat. So I work making sure you don't have any compromise as far as your vascular system, heart, kidney, referring out to those. Because let's say that somebody comes in with congestive heart failure, and they have both legs are swollen, like, you have lymphedema, and I start wrapping their legs and I shunt all that fluid to a heart that can't pump.
That's a bad thing?
They would not make it.
Right? Or you take all the wrapping off,
if they come in and they say, I have lymphedema, but last week I gained 20 pounds all right here, and I have a shortness of breath when I lay down. I'm like, out of here.
Yeah, that's not safe. Yeah.
Not touching you.
Right? So there's things that we need to know. If they come in and they have an infection, I'm not going to mobilize that infection, right?
You shove the stuff in the wrong place,
Research does show that it's safe to treat patients with metastatic cancer. So even if there's an active metastases, treatment for lymphedema doesn't spread the cancer, but it can hold the symptoms.
Cool.
So I would refer to the LANA website, so the Lymphedema Network. They have a list of providers for LANA certified providers, or close training, who I'm through. They also have a list of close training providers.
Do we have that on here, close training?
I think so.
I saw that you had that at the front, that you were certified in that.
Yeah.
Okay.
So that's who I did the school through.
And so they can go through that to find somebody that
to find a therapist. Does it have to be a therapist?
No.
Okay.
It'll say lymphedema provider, certified lymphedema.
So you don't have to be a physical therapist to get certified in?
No, it can be an OT, PT, PTA, and a massage therapist can do the manual lymphatic drainage, but they can't do the other parts of it. So they have to be referred by.
Okay.
I
got you. Cool. I had another one I was going to go with that, but you did such a great job. I think you covered it. So. About docs. Just having to do with docs, and you and listening, you say, like, you're stuck with me. I'm your point person, right? How is insurance covering this? How many treatments are these people going to get from you? How often they need to get treated? Of course, it depends how often they need to see you. But with insurance, it doesn't depend, because they tend to say, well, this is what you get, this is it, right? Is there something you have to deal with that? I know it's usually a nightmare, so.
Yeah, insurance can be tricky. So let's say, and it's a little different depending on the stage of the person, right? It always depends in physical therapy. But let's say somebody comes in with lymphedema for the first time. They haven't been managed before. If they need to be fitted for gold standard, is we're going to do manual lymphatic drainage, compression wrapping, which is serial bandages to gradually decrease the limb size over 2 weeks. So I see them every day, 5 days a week for 2 weeks. After those 2 weeks, we take measurements and get them fitted for a custom garment. In that interim, while we're waiting for that to arrive, we work on their exercise routine, because ultimately moving forward, they're going to be most successful if they can manage it themselves. So I teach them how to do the lymphatic drainage on their own, because while it can be a very soothing tool, it's not our strongest tool to prevent and manage lymphedema. Exercise and compression and skin care are our tools there. So then doing an orthopedic screen, finding those deficits, working on that. They get their compression garment, make sure it fits. We do a couple of visits, more in orthopedic, transition to 1 to 2 times a week as needed. And then once they manage on their own, usually at like the 6-week mark. So depending on their insurance will, in America, most insurance companies will cover treatment for lymphedema, but they will not cover the supplies. So Medicare still terms compression garments and bandages as cosmetic. Most insurances follow suit with Medicare,
of course,
so they don't cover it. Sometimes they will cover pumps, and that's a whole other triad. I mean, soapbox I have, but So anyway, so they might cover that, but they will cover the treatment. They just might not cover the supplies. Blue Cross Blue Shield is not necessarily dropping names, but dropping names, they do really well. Some commercial insurances have pretty good coverage. It's just typically the federal payers that don't.
Okay.
Yeah.
I love it. I hate it.
I hate it too.
Yeah, it's just a nightmare.
Unless you have open wounds. That's the other thing. It's like they'll cover it if they have open wounds.
Oh, so they have to be bad enough for them to cover it.
Right.
Okay.
Because open wounds, that means it's like...
Which typically means they're going to be in wound care.
How many stages are there?
4.
Okay.
Now, so we went through a few things, and I asked the last question, so it's your turn.
Okay. So, do diuretics help with the lymphedema?
What's a diuretic?
Good question.
Okay.
Diuretic is typically a pharmaceutical that helps with getting rid of fluid. So people are given diuretics if they have kidney disease, liver disease, things that typically add to increased swelling. I've seen numerous patients that's one of the questions I ask for their AGs and EASes is does it change with diuretics? Typically, lymphedema or lymphatic fluid does not change with diuretics alone because it's not directly in the blood system, right? So, and people were like, oh, well, my left leg is swollen. Maybe I'm eating too much salt. Salt's not that picky. It's not going to just choose one leg, right? So you don't need a diuretic.
What?
Yeah. And then on top of that, diuretics often lead to dehydration, which then makes the lymphatic fluid more viscous, which leads to more buildup. So sometimes people actually have more swelling of lymphatic fluid if they take a diuretic.
I think I've heard the word viscous in a long time. I like that.
The viscosity.
Very cool.
It's like molasses in there.
Cool.
So you have a patient that they have no idea they have lymphedema. Their doctor put them on diuretics. What do you do then?
Well, number one, I never throw anyone under the bus because I'm also not a primary care physician, so stay in my lane. But if they don't have any other conditions that lead to that, and I think that they have lymphedema, I will call the physician and specifically talk about why I think they might benefit from treatment for lymphedema. And then we use that as a trial run. And if their swelling is managed, say to the patient, consider discussing that, hey, your swelling is significantly decreased, you're having these other signs and symptoms with a diuretic. Is it possible, you can reevaluate with your physician as to whether or not it's something you want to continue to take.
Yeah, because you have to be careful.
Yeah.
Yeah.
You can say it right, yeah.
And also, if there's a reason, my question is, how could it be true? How could it be true that the physician thought this was important? The patient's report might not be the only part of that story. So there might be something else the reason the physician, how could it be true that a diuretic would be helpful? Assume that they meant the best that way versus immediately saying, oh, they shouldn't have done a diuretic, blah, 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 blah.
Right. Yeah. I don't think any physician is wanting to harm.
No. Yeah.
Yeah. But they're just, yeah. So, okay. So you talked about where people can find a lymphedema specialist.
Somebody that specializes. Yeah, we got.
Can you say again the two places that they can look?
Sure. LANA, LANA. That's
Okay.
the network. LANA certified, and then a close training is where I'm certified through.
Okay.
So closetraining.com, and I believe they have a registry or a list of lymphatic therapists.
Okay. And we'll post that in the notes. And so it's lana.com?
Mm-hmm, I believe so.
Okay. We'll look it up. Okay. And then do you see how much information do patients know about lymphedema when they are diagnosed with lymphedema?
Good question. Usually very little. One of the biggest causes for lymphedema in our area, so we have morbid obesity, but then also treatment for breast cancer. So a big portion of my patients typically come from that region. One in 3 women that go through breast cancer treatment will develop lymphedema, but it's usually not for 8 to 12 years afterwards. Wow. It takes a while to come on. So, wow. And sometimes that's like at the end. Some people get it immediately. Some people get post-operative swelling. They've had a mastectomy. I mean, those are big procedures.
Mm-hmm. So
if you were to look at a picture of the lymphatic system and you see all the watersheds across the breast region and then across the abdomen, well, if you have a deep flap procedure, they cut right through the watershed to repair or to reconstruct. Every time you have a surgery and insult, our lymphatic system is a main part of our immune system, and it's going to react. So that's usually, some people can develop lymphedema just from having cancer because of the immune response. All that to say, treatment for breast cancer, because it can happen immediately afterwards, or development, seromas or other things that happen that eventually lead to it within a couple years later. So sometimes the connection is not always made that's where it's coming from. Mm. I have seen recently an influx of patients coming in prophylactically where they say, oh, I had a mastectomy, I'm going to go in and learn about the signs and symptoms of lymphedema, learn how to do the massage.
Really?
Yeah.
Good for them.
Yeah, teach them how to do that, how to take measurements on themselves, good information about, hey, if you're going to go on a plane ride, high elevation, things that put you at increased risk for developing lymphedema. In a country like, or continents like Africa where they have a higher risk of filariasis, which is the main cause of lymphedema outside of the United States, which causes like the elephantitis, like a really, really big swelling. Make sure you have your vaccines, make sure you have insect repellent, things like that. So more like how to prevent it, I guess.
I was going to ask you that's my next question.
Mm-hmm. Yeah. So prevention, knowing the signs and symptoms, knowing the risks. If you feel heaviness, swelling, that you contact your PCP and get in with a CLT right away to see if we can mitigate the risk and decrease it.
Okay.
Yeah.
Have you seen successful outcomes with preventative care? I mean, I guess it's hard to say that whenever they don't have it. So
I mean, I think so, because I haven't seen. I mean, I've been practicing 4.5 years, so I haven't seen a lot of I don't have enough data yet. But I have seen patients that come in that they've gone through chemo radiation and they're diagnosed with lymphedema, and they do have some congestion around the scar, but their biggest complaint is that it's painful when they reach overhead, and they have axillary cording. So we go in, we do some massage, completely alleviates the cording, and then remembering and educating people that whenever you have radiation, it goes in through the front typically and posteriorly out through your rotator cuff. So then people aren't developing frozen shoulder over time because they aren't moving their arm because it hurts. So they don't move their arm, they don't exercise their arm, they get increased swelling, it doesn't pump through. So kind of trying to prevent those other orthopedic issues as well that could eventually lead to lymphedema.
Okay. So is that maybe one of the main causes? No, I mean, you have your main causes, but then, with like lack of exercise, you know, the axillary, what did you say, the
Axillary cording.
the cording, like that stuff, that can tend to lead to lymphedema if it's not treated properly in the beginning.
Right. Because that system is overloaded, and then it overloads everything behind it.
Okay. And how about nutrition? Is there certain foods that should be avoided that might cause inflammation, or is there...
Yeah. There is a lot of budding research right now for the ketogenic diet for the lymphatic system. Our lymphatic system primarily runs on fats. So whenever you have lymphedema or dysfunction, your body says, oh, we aren't going to have enough fat to run the system because it's already working overtime and not doing well. So your body starts to store fats in case it needs it. Well, the more it stores it, the harder it is for your metabolism to tap into it. So then you have this buildup, which is why there's a connection between morbid obesity and lymphedema, not only in the increased weight and sedentary and things like that, but also in that your lymphatic system, your person is essentially starving even though there's fat stores there because your metabolism doesn't have the keys to unlock your fat stores. So there's burgeoning evidence about the use of the ketogenic diet for that. Always, I would say, in line with your PCP because that affects a lot of other things.
Medication and...
Absolutely. Using a nutritionist, I always recommend that if you're going to do any sort of that big change to match your output, right? So if you're going to start a new exercise routine and this and this and this, do you have enough intake output? Is it matched across the board?
Yeah, and what is helping, what's not helping, and how to kind of go through the process.
That's one of the things,
smoothly.
like how do you know you're getting a nutritionist or a physician that knows anything about lymphedema? I know a lot of nutritionists and they don't know anything about lymphedema.
Yeah, it's true.
So how do they know that? They're like, well, no, you shouldn't do keto because it's bad for you, because I've learned that through my training. That's what they'd say. So how do you find out, how do you find one that would help you do that?
That's a good question.
Poo your idea.
Yeah.
You know,
so hopefully there's, nutritionists maybe go more towards a dietitian. There's quite a few research articles and books out right now about that. I can't remember on the top of my head, but if you just Dr. Google
Scholar it or something.
Yeah, ketogenic diet for lymphedema. There's a big book on it,
cool.
written by an OT and PhD who focuses on that.
Okay, good to know. We'll make sure we try to put that in there, because that's the problem I see is, like, nobody wants to harm anybody. They only want to help, but then everybody gets on their soapbox or their train, and they don't want to listen to anything new. Yeah. Especially when everything's been poo-pooed really bad by other people.
Yeah, I've seen that. I had a patient that was morbidly obese, and it led to pannus swelling. And once that happens, that just typically does not go down. It has to be surgically removed, but it's also very uncomfortable, and it leads to genital swelling, which can lead to a lot of other issues. All that to say, she had tried so many things to lose weight, and like, I know when sometimes people say I've tried everything, they haven't really truly tried everything.
Yeah. But it's an ongoing battle. Like, it's
right.
hard. Yeah.
And she took it to her physician, well, I want to try the ketogenic diet, and they said no because of whatever reason. And so my next suggestion was getting with rather than a dietitian, more like a nutritionist that's going to help you with your macros and your exercise output. Because at least if they're in line with that diet, you can at least target fats, proteins, and then to me, learning how to do that is a little bit more manageable for lifelong management than crash diets or, things like that.
Yeah. I think a big thing is kind of taking upon yourself, if you do have lymphedema, to do more research and to find out what's out there instead of just kind of relying on information just given to you. Like, kind of take control of it.
Yeah, absolutely.
Yeah.
And if anybody, another recommendation is, even if you haven't been diagnosed with lymphedema, if you notice that you have swelling and it persists for more than 2 to 3 weeks, then, why could that be? Or how could that be? Finding the answers, finding a provider to see if they can help you with that answer.
Like, that should kind of bring a little red flag to everybody.
Yeah.
Like, okay, something's not working normally.
Cool.
Yeah.
Cool. Yeah, we definitely need to let people know how to catch it, prevent it.
No, I
and
think
take
that's
care of
a
it.
big thing is focusing a lot on that preventative care and trying to avoid it getting so bad to where you're at.
Because like you said, the
You're
two
at
main
hard
things
point.
is pretty much not metabolic disorder, but like, overweight, obese, and then cancer.
Yeah.
That's the main ones that cause it. Not just because I drink too much. No, I don't drink, really. You get swollen feet. But if it's 2 weeks long, that's whenever there's something not flowing right. Cool.
And it's changed my practice as an orthopedic therapist, because if somebody comes in post-op TKA, the first thing I'm going to do is MLD for their knee, like starting with a sequence in the appropriate fashion, because there's a lot going on there. Another risk for developing lymphedema is trauma, and surgeries are big controlled traumas.
Oh, yeah.
So and most of my patients, I'm doing MLD and having them get
MLD,
manual lymphatic drainage.
There you go.
And then a compression sleeve that at least covers the knee and the lower leg when they're phase of healing and when we're exercising, until that swelling kind of gets its way out.
Okay.
You don't want to overstretch it. It doesn't come back.
And then the other thing, your lymphatic system is innervated by your autonomic nervous system. So I use manual lymphatic drainage for my patients that have persistent pain or other hypersensitivity, other things going on, because it directly affects your heart rate, digestive system, things like that.
CRPS?
Absolutely.
Really? I didn't know that.
CRPS.
We know some good friends that need that.
There's a big research study about all the different autonomic effects for manual lymphatic drainage.
Okay.
I also use it for abdominal pain and my patients that have intense menstrual cramps, PCOS, things like that.
Wow.
Because we've dealing with all the patients we've had with the lower extremity trauma they've had.
And with multiple surgeries, trauma over
Yeah.
trauma over trauma, and then they get the CRPS.
Yep. And they become a crip.
Yeah. So
Crips.
it's a non-threatening stimulus, soothing, and then things I've done is using like 2-point discrimination, laterality training, other things like that, testing before and after, teaching it how to do it on themselves so they have a non-threatening thing to turn to if it's painful.
It's interesting.
Something we could definitely use.
Yeah. Or provide information for.
That's what I meant.
Yeah.
Because that's all we do is provide
Refer
information.
out.
Yeah. I was like,
I ain't gonna be using it. No.
Well, that's why I was like, I don't know much about lymphedema. Why do a video without, someone who knows about it?
Google foo.
Yeah. Well, I looked up my research and it said that.
Yeah.
So, well, awesome. You said specific exercises, swimming's really good with compression garment, scapular retraining, and you said hip strengthening, making sure like, hip flexors.
Diaphragmatic breathing.
Okay.
Our main thoracic duct is here, so using your abdomen in tandem, so TRA training with diaphragm for true compression there.
Okay. So give us an example.
Of
Diaphragmatic,
Yeah, so breathing in through your nose, filling your belly up with air like you're going to sing opera, and then breathing out through your mouth. And you press down so you feel your belly button draw back towards your spine to press out the rest of that air. That's your TRA, your transverse abdominis working coordination with your diaphragm.
I know, you'd even say that you were an opera singer, right?
Yeah.
So are you going to sing for us?
Yeah, right. Break the glass.
So you did opera singing. Was that after college, or when did you do that?
I majored in opera theater for a couple years before I switched to kinesiology.
It's a pretty big change.
Yeah. I hated performing.
Okay.
I loved performing. I did not like competing.
Okay. Kind of took the fun away from it.
Absolutely.
Yeah. That's tough. I mean, a lot of my family is opera singers, is what I was told, right? That's what
I believe it.
Yeah.
Your family's very...
They're all Czech, and so over there, they're opera singers. Like, really? That must be why I sing so well, right? Yeah. No.
Well, yeah. I watched one video about auditioning for the Met Opera and like the life of an opera singer, and I was like, absolutely not.
Yeah, no, I'm gonna treat patients.
You lost me. I'll go to school for 10 years.
For 10, 20 years.
I thought about doing it, but I can't get the warble.
It's actually the most, no, I would say not easiest. It is the healthiest way to sing. It doesn't put nearly as much strain on your vocal cords to sing opera.
You'll get notes. Like on, what was that? Pitch Perfect? I got notes.
Notes, yeah. So you can hear, like, people can change your voice. It all has to depend on where you throw the air and how much you allow the vocal cords to vibrate.
Yeah. I sing Do a Deer every night to our kids while I practice.
Do a Deer.
They love it.
Yeah. Sound of music, yeah.
Okay. Anything else that if we didn't hit on, or I think we went through a whole lot of good information.
What's Katie Grace Lowry?
She just asked, or on the question, it was like if you have any Instagram or anything.
Yeah,
like
so
that.
that's just how somebody finds you if they want to get a hold of you?
Yep.
We have tons of stalkers after this. So we have like all 135 of our subscribers.
Oh man.
Yeah.
Wow.
But what I notice is that information isn't out there available for
exactly.
patients.
That's
so
why we do
if someone comes to us and asks about a certain anything, then that's our job.
Yeah, that's what we're here
to
for.
Provide it.
Help people find the right provider they need.
Yeah.
And
And
so that's why we're
I
doing this.
won't do if I feel like I can't answer the question, I'll tell you to schedule an appointment.
There you go.
Awesome. All right.
Cool. Thanks, Katie.
Thanks.
You're welcome.
Thanks for coming. It's a good one.